Hi guys, my name is Lily and welcome to my video tutorial on the functions of the cranial nerves. I decided to make this video because in the past I found it really difficult to remember all the functions of the cranial nerves, and I know it can be quite a daunting topic to revise, so hopefully this video will help to break it down and give you a few tips to help you remember them and feel a bit more confident. This video will be focusing on the cranial nerves 1 to 6. So we start nice and straightforward with the first cranial nerve, which is the olfactory nerve. It's only got one function. It's a sensory nerve, and it's responsible for one of our special senses, smell. It's not routinely tested in clinical practice, but it would be very easy to test just by giving the patient some coffee or some lemon and asking them if they could smell it. The second cranial nerve is the optic nerve, and it's another sensory nerve, but it innervates the retina, so it's responsible for our vision. It's a little bit more complicated to test in clinical practice because there are 5 elements you need to check. So to help you remember these, I've developed the mnemonic Afro cab. So here's a cab with an afro to try and help you remember. A is for acuity, F is for fields, R reflex, O ophthalmoscopy, remember not to forget the H like I did here. C is for colour, A is for accommodation, and B is for blind spot. So starting with visual acuity, acuity is really just another way of saying clarity of vision. So for this you're going to need your Snellen chart. To use the Snellen chart, the patient stands 6 meters away and covers each eye in turn. The smallest row that can be read represents the visual acuity in that specific eye. Next we have F for fields. So students are usually quite comfortable with testing the visual field, so I thought instead that I'd focus on interpreting some potential findings. So what I'm drawing now is the visual system through the brain, which shows the eyes, and the optic nerves, and the optic chiasm, and then the optic tracts and optic radiations. And the blue pen at the top is supposed to demonstrate the nasal and temporal fields as they enter the eye. I find this diagram, if you can draw it out, really helps to make sense of where the lesion must be to cause a particular visual field defect. So looking at these 3, number 1 is a lesion in the optic nerve itself. And a lesion in this location means that no information from the retina of the right eye is able to reach the occipital cortex at all. And so this is probably where the lesion would be if someone presented with a blind eye, in this case a blind right eye. Lesion number 2 is occurring at the optic chiasm. At the optic chiasm, information from the temporal visual fields crosses over, but the nasal fields are not involved. So a patient with a lesion of the optic chiasm would likely present with bitemporal hemianopia. Lesion number 3 is located in the right optic tract, and this tract is carrying information from the temporal visual fields of the left eye and the nasal visual fields of the right eye. So a patient with a lesion here would likely present with left homonymous hemianopia. Going back to our Afro cab mnemonic, R is for reflex, and in this case it's for pupillary reflex. This reflex is coordinated by the optic nerve and also the oculomotor nerve, which we'll come on to in a minute. Being a sensory nerve, the optic nerve is the afferent neuron, and it senses the light coming in. The oculomotor nerve is the efferent neuron, as it's a motor neuron, and it coordinates pupillary constriction, which is the response. I'm not going to talk too much about ophthalmoscopy because I think that this is a separate skill in itself and gets covered in other areas of our teaching. To assess a patient's colour vision, you'd usually say you want to use an Ishihara colour plate, but again, this doesn't happen very often in a ward-based setting. Accommodation refers to the accommodation reflex, the second of the reflexes involving the optic and the oculomotor nerve. Accommodation refers to the changes in the eye that occur when we move from focusing on an object in the distance to an object up close. The blind spot is a place in the visual field that corresponds to the lack of light-detecting photoreceptor cells in the optic disc of the retina. Clinically, we like to assess the size of the blind spot by using a pin with a red top. So that is the olfactory and the optic nerves done, 2 sensory nerves completed. And now we're going to look at the oculomotor nerve, which is cranial nerve 3, the trochlear nerve, which is cranial nerve 4, and the abducens nerve, which is cranial nerve 6. All these nerves are motor nerves, and together they control eye movement. To feel confident knowing which movements are done by which nerves, it's probably useful to think about the muscles that they innervate first. The oculomotor nerve innervates most of the muscles of eye movement, and helpfully it also has the longest name. In this diagram, the directions of movement that are controlled by the oculomotor nerve are going to be drawn in blue. The muscles that move the eye upwards are the superior rectus muscles. Movement of the eye inwards is controlled by the medial rectus muscles, and movement of the eye downwards is the inferior rectus muscles. Movement of the eye up and out is the inferior oblique muscles. In addition to these movements, the oculomotor nerve also controls eyelid opening, which is the levator palpebrae superioris muscle, and also does pupillary constriction, which we spoke about earlier, which is the sphincter pupillae, and also accommodation, which is the ciliary muscles. We spoke about that earlier too. The downwards and in motion that I've just drawn in red is controlled by the trochlear nerve, which innervates the superior oblique muscles. The easy one is the sixth cranial nerve, which is the abducens nerve, and this moves the eye outwards and controls the lateral rectus muscles. So, we've made a lot of progress so far. We've done the olfactory nerve, the optic nerve, the oculomotor, trochlear, and abducens nerves of eye movement, but we missed out cranial nerve number 5. So, now it's time to think about the trigeminal nerve. So far, all the nerves that we've covered have been either sensory or motor, but the trigeminal nerve is both. It's usually remembered for its role in sensation of the face, but you mustn't forget that it also controls the muscles of mastication, or chewing, and that's its motor component. So there are 3 branches of the trigeminal nerve, which I've drawn in green across the face of this lovely androgynous individual over here. And the one which goes across the forehead is the ophthalmic branch, the one across the middle of the face is the maxillary branch, and across the jaw is the mandibular branch. The ophthalmic branch of the trigeminal nerve has a role in the corneal reflex because it innervates the cornea. It's a sensory branch, so it's the afferent neuron, and the facial nerve acts as the efferent neuron and coordinates the motor response, which is blinking. Clinically, you would test the trigeminal nerve by touching the areas of the face innervated by the 3 branches and comparing right to left. So that brings us to the end of the trigeminal nerve and also to the end of the video tutorial. Thank you for watching. I hope you feel much more confident with the first 6 cranial nerves, and I look forward to hearing your feedback.